Hello, this is Dr. Felitko. I'm a board-certified prosthodontist. I have a private practice in Chantilly, Virginia, specializing in implant dentistry. I'd like to address 5 important questions you might ask when you have to determine your implant dentist. Hopefully, you have useful information from this video so you can make a great informed decision. What is the most important factor for successful implant? The most important factor for successful implant is, I would say, the doctor. The doctor's experience and skill level is very important for successful implants. A lot of scientific articles compared many factors involving implant treatment. They all concluded the most important factor is the doctor. Doctor's skill level and experience is very important. So you have to check for your doctor's credential and then training and experience. So make sure the doctor has confidence and good experience with implant treatment. Where should the patient go for implant? Usually the patient is seen by general dentist, and then the doctor found a missing tooth and recommend implant treatment. And usually general dentists refer patients out to the specialist like periodontist or surgeon or prosthodontist for placement of implant. And then once the patient has implant placed and he was referred back to the restoration doctor, which is your general dentist, and dentist restores your implant. So this is general and most common sequence, or you can find your own implant dentist specialist and go there and then having all surgical and restoration service and under one roof. That would be another excellent choice. What procedures should the patient expect when it comes to implant treatment? The implant treatment usually consists of 2 phases. The first phase is surgical placement of implant. The second phase is the restoration of the implant. The first phase of surgical placement of implant, patients get implant placed surgically with sometimes additional procedures like bone graft, sinus lift. And then once the implant fully healed inside the bone, then 3 to 6 months later, patient will receive restoration of the implant, which involves taking impression and delivery of the restorations. And total treatment period usually takes 3 to 6 months or even longer when it comes to bigger cases. What is life expectancy of implants? That's a question I got from a lot of people. And very fortunately, implant can last way longer than other forms of restorations. Implant doesn't decay, which means implant can last way longer than crowns, bridges, or even veneers. They have a lot of failure rates because of cavity underlying the tooth structure. So you don't have to worry about decay of implants. However, implant can get some gum problem, gum inflammation. So that's why you need some professional help, and your oral hygiene is very important. But as long as you can take care of your tissue around the implant, implant can last your lifelong. How much do dental implants cost? I got a lot of questions like this from my patients. I'd like to emphasize the value of implant treatment. I truly believe the implant has the best value to replace your missing tooth. It doesn't decay unlike conventional crowns and bridges. As long as you take care of its gum tissue around it, it could function very long time, even for the rest of your lifetime. So implant can bring a lot of benefits to you overall. It has the best value. If you want to know a specific cost, I'd like to highly recommend to go to your implant dentist because it's very case specific. In general, it could cost between $1,500 to $6,000 per tooth. Let's do a recap. Question number 1. What is the most important factor for a successful dental implant? The most important factor for a successful dental implant is the doctor. Question number 2. Where should you go for your implants? To find out the best place to get your implant, consult your dental dentist or see a specialist. Question number 3. What procedure should you expect? You should expect first the surgical phase, followed by the restorative phase. Question number 4. What is the life expectancy of dental implants? With proper care, the life expectancy of an implant is lifelong. Question number 5. How much do implants cost? Very generally, implants cost around $1,500 to $6,000 per tooth. Once again, I'm Dr. Philip Coe, and thank you for watching this video. I hope you found the answers to some of the questions you had about dental implants. If you have any more questions or would like to schedule an appointment, please do not hesitate to call us.